Brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health from Huda TV. Giving care to the elderly, especially in the Islamic society where most of the families would not love to send the elderly or the loved ones to a special home to be taken care of, and they insist to take care of the elderly at home. So those who gave this care actually have the difficulties with a new problem of caring for the elderly. They have the person they love, and they want to give the best chance for them to live happily, to live in the best way, to care for them. And then they are struck with a problem that they are not really prepared to do this. Today we'll be talking about both sides, the caregiver and the stresses they face and the problems they might have, and on the other side, the elderly person that we need to give care and attention for, and we need to take care for. So with us today is Dr. Tamir Muhammad Farid, professor and consultant of geriatric medicine. Welcome, Dr. Tamir.
Welcome.
The person who decides to take care, or the family that decides to take care of the old person they have, and they give them or her the attention and the care, they're struck with a problem of they don't know how to deal with it. They give the best they have, but they don't know if this is the best for the person itself. So this puts them into a great stress. How would you define the stress that they're facing first?
Yes, actually, as we see in this slide, this is a fundamental problem, and this is a fundamental concept that caregiving relationship is not always about stresses. It's a mixture between loads of the caregiving, yes, and the rewards that are achieved through caregiving. It's a mixture of satisfaction, like a mother caring for her child. Mm-hmm. However, unfortunately, most people will get only the loads because they are not prepared, educated enough to enjoy this relationship. Yes. As a mother that have never been prepared to receive her first child. So exactly, they give the loads without the rewards.
That's true. Mm-hmm. So not all persons who are involved with the care of the elderly are having the same way of dealing with the person they're caring for. Some of them would give all the efforts, all their life, actually, they devote their life to that person. And others on the other side wouldn't bother about him, maybe, or her, and wouldn't bother about giving even the very basic care outlines. So between this and that, where should the person or who's giving the care would stand in?
Yes, absolutely true. Absolutely true. There are, these are, as you see in this slide, this is a slide about common classifications of several degrees or several degrees of the closeness of relationship between the caregiver and the recipients. Mm-hmm. It ranges from the fusion, where the caregiver, all targets in life, fused to be imparted into the recipient, so he doesn't think about anything about his own existence. The only thing that matters in his life, how to relieve the pain of the recipient, to reduce the hernia, to improve their sleep quality, and they don't bother about their job, about things. This is called fusion.
They become detached from the world,
and imparted into the recipient. They are no more a separate entity.
Yes.
And in the very cold, frozen side, there is abandonment. Mm-hmm. They don't just care if they die or they're suffering, they don't sleep. This is the worst. Between them, there are several degrees. What's important for us to be in the middle, ranging from general support to occasional care, day to day.
Mm-hmm. So, between all these streams, you would recommend that
they stay in the middle.
In the middle.
And they to avoid the cold side, where the first sign is deterioration of the recipient, and the warm side, where they are faced with the burnout.
A burnout. So
burnout.
Yes, exactly.
Yes.
Because after some time, they couldn't stand the
yes.
the stress they're being in, especially if they're so much into, or as you said, fused into the problem of the elder
Yes.
person.
And the burnout, as you see in the slides, there are early signs
Yes.
of the burnout. The physical, they become complain continuously of exhaustion and being worn out, and emotionally they are angry
Exactly,
and
yes.
aggressive, and they loudly speak with all or person around and complain. Socially, when they stop receiving calls or giving calls on birthdays, and they are totally isolated, or financially, once they see that their financial assets
yeah.
are decreasing, are being itched, they don't just wait until they feel they are broke. Once they feel they are touched, their financial assets are touched, it is a sign of burnout.
Yes. So to avoid this this burnout, and to be able to be continuously giving the care without losing his own self, what should a caregiver do?
First of all, the caregiver should acknowledge that there is a problem.
Yes.
Yes, there is something called I have a problem of under stress. They always should express their worries, and they second have to learn about the problem they have to caregive. Like a mother have to learn about the caregiver skills for her child. Then be realistic, set realistic goals. It's a stroke, okay, thank God it is not dead, but he's not going to walk again. Don't fight until he walks.
Yes.
This can be defined by a professional.
The expectations. They should not put more expectations that more than is expected, so that they wouldn't strive more, not getting anything from it.
Yes, they are going to fight the windmills, and this is done by the professionals, of course.
Yes.
Build an army. Don't fight the problem alone.
Yes.
Just invite more people, invite your family, invite your friends, those who can. Don't face it alone.
More assistance.
Yes,
so
more assistance.
They shouldn't take the burden on themselves.
Absolutely.
And they say, no, I can take it from here.
No.
I don't need any help. Even if the help would be some bits from here and bits from there, they alleviate some of the
It's a marathon.
Stress.
It's not a 100-meter run. It's a marathon. So it's going to last for years.
Yes.
And even if this help they are going to invite is like taking the child to a school, it doesn't have to be the caregiving of the patient himself, but relieving them from other responsibilities, like getting your child to school, paying your bills. It will free some time for the caregiving process. Then you have to look into the mirror every day. You don't just let the caregiving process take you. Every day you have to evaluate yourself. Where am I? Am I doing well? Am I taking my medications? Yes. Am I taking good care of myself, or am I being taken by time?
So that's the key. You take care of your elder person, and you take care of yourself as well.
To be able to
continue
and to serve better. Because if you don't take care of yourself, we'll end up with two patients not being served by anybody.
Yes, exactly. That's the problem.
And by the way, the commonest cause of institutionalization of an Alzheimer patient with a chronic condition is institutionalization of the caregiver.
Oh.
So once the caregiver goes to school, goes to the army, they're directly being institutionalized.
Yes.
Yes. And always communicate. Be in touch with people. They will reflect, tell you how you look from outside. And of course, this is a chronic problem, but someday it's going to end, for the better or the worse. So at this time, you need to have a life, social life, a private life.
Yes, or else after the problem is gone, either for the good or the bad, then he's left out with nothing
void. Yes, void. All my life is finished.
Yes.
Yeah.
So, as you said, you take care of the elderly, but you have to take care of yourself.
That's more
so
important.
When it comes to taking care of an elderly, this is, of course, means almost a 24/7 service for that person, according to his condition, of course, or her condition. But at least you have to know what to do. You have to know how to give care, so you would be doing it properly, not just trying to do something good, but at the end you're doing maybe something that might harm the person you care for.
Absolutely.
So there are many aspects.
Yes, but
starting from picking him up from bed, putting him into bed. I mean, mobilizing the person. How do you recommend for a caregiver to do the mobilization? of a person who needs, of course, if he's able to mobilize?
Of course. Well, there are many, unfortunately, people will do harm to their elderly rather than help without being properly trained.
Yes.
As you see in this slide, there are several positions.
Mm-hmm.
The first one on the left, upper left,
Yes.
is one trying to raise his beloved one. This will harm her back, and this actually pins the elder to the sheet. We will try to think how we are going to stand. First step is to lean forward, to put my torso, my center of gravity, between my knees, which is center of support.
Yes.
Without this, I'm unable to stand.
So first step is to lean forwards.
Pull the elder until he's able
Yes.
to center his body between his feet. Don't just pull
between
him,
his
just
knees, yes.
raise him.
Mm-hmm.
This will save energy to you and give confidence to the elderly.
Yes,
Because
you don't put your hands under his or her armpits
and
start raising.
Yes, it's
That's
very
right.
difficult for him, and it actually prevents him from any chance to stand, even he or she can stand.
What about the person who's laying in bed sleeping?
Okay.
I mean,
This also I have, as it's seen in the slide, in the lower left corner,
yes.
there are a lying person. All you have to stick stick on the ground,
Yes.
maybe it's a walking stick, and let him grab on it and pull. It
Yes.
to, as you see, it can raise him easily,
Mhm.
without effort from my side or from his side.
Yes,
and
of course.
And when walking,
Mhm.
the most common problem is pulling an elderly. Once you pull an elderly towards yourself, reflexly, he tries to maintain his balance by throwing himself back, or herself back.
Yes.
So the best way is to support them from their back and guide them by the other hand.
Mhm.
Just a proper support, not too much to throw them forward, or too lax to let them feel they are unstable. By this way, they get best chance to maintain their balance and their confidence, and they walk easily.
Mm-hmm. And walking, of course, or even ambulation, if the person does not walk, he has to do some exercise. He has to move his muscles or her muscles,
Yes, of course.
so they wouldn't have stiff joints and wouldn't have wasting of the muscles. And of course, movement is life.
Yes, and that's why we call it mobility assistance, not mobilization. Mobilization, it's like putting a person in a chair and moving.
Yes. We have a short break, and we'll be coming back to hear more from you, more advice for those who giving care for the elderly persons, how to deal with it. Brothers and sisters, please don't go away. Inshallah, we'll be coming back to talk to you more about giving care to an elderly person, so stay tuned. Until then, Assalamu alaikum wa rahmatullah. Dear brothers and sisters, Assalamu alaikum, and we're back, and we're still talking about the giving care for the elderly person, and we have with us today Dr. Muhammad Farid, professor and consultant of geriatric diseases. Dr. Muhammad, we were talking about Dr. Tamil, we were talking about the care for those who are able to walk.
Yeah.
But of course, sometimes those who are not able to walk, we should need to take care about the voiding problems,
Yeah.
the urine and the stool, and how they can do that easily. It wouldn't be easy, but at least the best way to do that, so that we should care about it. How would we care about this problem?
Okay. Of course, voiding
Yes.
is important, because as more people try to avoid it, it is the origin of many problems.
Mm-hmm.
I have a slide, as you can see in this slide I have. First, you have to believe that voiding problem with elderly is unacceptable. That
Yes.
means it's not good with old age to have they are uncontrolled of urine or stool. It's a disease that's common with age, and it's treatable. You have to think of the cause.
Yes.
There are causes in 1/3 of problems. It is the medication, one of the medication they are taking. There are common causes like urinary tract infections. There are common causes like stones, and they are treatable. Then we come to what's called voiding schedule, and I love this because it is the most important intervention. Avoidance schedule, it's like potty training.
Like
If,
potty training for
it's like-
children.
Yes, it's like for elderly. You don't wait until you are struck by the desire. You start to be preemptive and start too early by going to the bathroom on fixed schedule. So it's called avoidance schedule.
You take the person to the bathroom, either he can move there, or you bring the
Urinal.
potty to, or urinary to them
On
on
fixed,
fixed basis.
yes.
Even
fixed,
if they don't have the desire.
Yes, that's exactly it.
Mhm.
It's an hour. Then, if they are dry after a week, we move it progressively by an hour for 2 hours the next
Couple of
week,
hours, yes.
then 3 hours, 4 hours, until they are free for reasonable time. For
Yes.
example, 5 hours will be fine for everybody to travel to another city.
Yes.
So this is it's called avoidance schedule, and it's like potty training, and it's very, very effective.
Yes.
And we don't have to forget about safety and support. With those who cannot walk or who don't have trustable balance shouldn't make a trip to the bathroom every hour. We should bring them a urinal
Yes.
or a commode beside them.
Yes.
When it is infrequent, for example, infrequent trips every 4 or 6 hours, we can go to the bathroom. But it would be difficult to go to the bathroom for every hour, even for a young man.
Yes.
So for voiding, we have to believe it's unacceptable, because most causes are treatable, even they have been there for 30 years, even partially treatable. You have to find the cause and stick to the voiding schedule. It pays back.
Yes. This takes us to some problems like diapers rash.
Yes.
Or even the whole body, caring for the whole body skin, which is very important to maintain a person with problems free, especially the bed sores, as we see in the elderly.
Yes.
Yes.
Actually, when we come back to the elderly with are incontinent and they use diapers, or incontinent stool and they use diapers, the problem is basically the same as the children. So we have to keep their skin dry and clean as possible by frequent checking the diapers. Once it's wet, it has to be changed.
Yes.
It cannot wait until it's full.
You don't leave it wet, because
You
some
don't
people
leave
would
it.
just say, okay, I'll do it
Yeah.
with the next
Hour or
evacuation
so.
or something like.
So it's like basically like children. You have to check it frequently. Once it's wet, it has to be changed, and the skin has to be dry. And you can use any ointment to isolate the skin from any wet fluids. This is for diaper, and we have diaper rash, but it's not so common elderly, but it happens.
Yes.
But we have bigger problem, which is pressure ulcers for those who are bed-bound or even chair-bound. Pressure ulcers arise from prolonged pressure on the skin. So when skin becomes trapped between two hard objects, like, for example, lying on one side for a long time,
Yes.
or even lying, being pressed against rails of the bed. This is a hard object. Even it's pressed against a soft part of the body, but it's
Yes.
a hard object.
Yes.
So we basically have to check for the pressure points on each single day. Once we find fixed, persistent redness in the skin,
Yes.
it should be trigger immediate professional assessment.
So you find the skin has some redness
Redness
that
that
has
is
been there
persistent.
for some time.
Yes, it doesn't go away from itself. by
What do you
itself.
do if you see that?
You have to seek medical advice, because if it is a pressure point and redness, it has to be pressure points and redness.
Yes.
It will be first degree pressure ulcer, and it is the best time to treat pressure ulcer when it's first degree. After that, treatment is very messy.
Yes, this is what I want to tell our viewers, because pressure ulcers, when they develop,
They are
they
messy.
usually are very bad problem, and usually are very difficult to treat. So it's better to detect them before they really progress into an ulcer.
Yes, that's exactly. It's the success rate for example, treatment of third and fourth degree, even with skin grafts, is only 50%.
Yes.
in best case.
And regular bathing of the person, putting him to bath without rubbing the skin with hard.
Exactly, and you have to make sure that the skin is dry after bath.
Yes, this is very
Yes.
important.
Because sweat or water or urine will make skin more liable for any disease, especially pressure ulcers.
Yes. There is a point that I want to ask about, and in my point of view, I believe that this is the most important part of caregiving for an elderly, which is the psychological aspect of this process, taking care of the person as a body and not as a person, not as a psychological problems and that he might develop, especially that they would develop some sort of a stress that will lead to depression afterwards, and usually it ends up with being detached from the surrounding atmosphere. So what advice do you give for the caregiver concerning the psychological aspect of the person he is giving care for?
This is most important. Most people don't appreciate this, but there was a research in New York that said that it found out that elderly have good self-image.
Yes.
Live 7 years more than those who don't have good self-image.
Yes.
And taking consideration that cardiac catheterization, heart catheterization will extend life by 3 years only. So the most important problem that I can see in elderly is morale. They lost their role.
Morale. Yes.
They lost their role.
How would you define morale?
It is psychological. It's the best way to say, the easiest way to define it is the psychological condition connected to a role in life.
Yes.
Those elderly who lost their role, they were important and they lost their job and their leadership position.
Mm-hmm.
You have to improve their self-image.
Mm-hmm.
Always talk to them about things they can do, remind them of their achievements to improve their self-image. Once they start to say, we could, we did, we were able, now so we are able, we
Mm-hmm.
can do. This will improve. This will encourage them to comply with their medication, with their examination.
Yes.
So
Give me an example of what should a caregiver do to achieve this high morale.
if a grandmother that used to be a good cooker always
Yes.
talk to her about recipes.
Yes.
If a father who's was an excellent radiologist, tell
Yes.
him about his achievement. When he opened the first radiology department,
Yes.
The special cases that he remembers.
Uh-huh.
If he was a carpenter, or tell me that
Yes.
let the child learn from him about the quality of wood.
Yes.
Let him talk about the special and the domains that he excels in,
Mm-hmm.
not the dependence
Yes.
parts of him.
You should not remind him
Of
or
his
her with
deficiencies.
the problem he has. It's rather you remind them with the good things they have and
Achievements they have.
achievements they have.
Yes.
Even if it's just looking into the family album and
Yes.
reminding them of the
Yes, just
good,
flip
memories.
through his memories when he was the leader of the family, and how he took his family from one side to another. Just going through his memories when he's a young man, this will do fine.
Dr. Tamer, thank you very much for being with us today. I'm sure many of our viewers would benefit a lot from the things that you gave us today about how to give a care for an elderly person. Dear brothers and sisters, thank you very much for being with us today. And of course, we still have more to talk about the elderly care of the elderly persons. So please stay in contact with us on the Facebook and on the email. Our email is health@huda.tv, and of course our new Twitter account is @health.huda.tv. And of course we'll be hoping that you give care of your family and you take care of your family as well. Until next episode, we wish you all the best of health. Assalamu alaikum wa rahmatullahi wa barakatuh.